Hello YouTube, I'm Dr. Fox. Today I'm talking about men and preconception health. People tend to think about preconception health as something that concerns women and not men, but this is not true. Preconception health is also about men, and there are several steps one can follow to improve their and their family's health. So, what can men do? Okay, step 1. Plan for good health and reproduction. Most likely you've thought about kids at some point in your life and have an idea about whether you want them, when, and how many. Taking care of your health is essential to achieving your reproductive goals. You need to make a plan based on your resources, values, and hopes for the future, and then you need to act on it. Even if you never have children, taking action to improve your health is always a good idea. Step 2. Protect yourself from STDs. For good reproductive health, men should be tested and, if needed, treated for sexually transmitted diseases or STDs. Even after you and your partner get pregnant, you need to continue to ensure you protect both of you from infection. Being pregnant does not stop a woman or a fetus from contracting or catching an STD. STDs can have very serious, potentially life-threatening consequences for a woman and her unborn child. Moreover, if your female partner contracts an STD from you, this infection can make them infertile. That is, it can leave them unable to become pregnant. Step 3. Quit smoking. Drinking alcohol to excess and taking illegal drugs can be devastating to your health. In terms of your reproductive well-being, alcohol and drug use can cause infertility in men, and you need to think about the effects of secondhand smoke on your family. Secondhand smoke from your cigarettes can cause diseases and early deaths among non-smoking adults and children. Smoking around your partner during pregnancy means that your children will be 20% more likely to be born at a low birth weight than a baby delivered by a woman who has not been exposed to secondhand smoke when pregnant. If you need help to quit, get in touch with a local treatment service or your doctor. Step 4. Stay away from toxic substances. If you are exposed to harmful and toxic substances such as synthetic chemicals, metals, fertilizer, bug spray, and cat or rodent feces at home or your workplace, your reproductive system can suffer. Exposure to harmful substances can impair your fertility, making it less likely that you will be able to get your partner pregnant. You need to learn how best to avoid harmful substances and how to protect your family. Certain diseases in children can result from exposure to only small amounts of harmful substances when your partner is pregnant or when your children are growing up. Step 5. Look after your fertility. Some men are born with problems that affect his sperm, while others can develop problems through injury or illness. Your lifestyle and general health can have a big impact on the health of your sperm. For example, the number and health of your sperm can be harmed if you have type 1 diabetes, you are a heavy alcohol drinker, you smoke cigarettes, you use certain illegal drugs such as cocaine or marijuana, or use anabolic steroids improperly. Or you're older, you're overweight or obese, you have been exposed to harmful substances such as bug spray and lead, you have suffered or do suffer from certain conditions such as mumps, hormone problems, kidney disease, you are on prescription or non-prescription medication or taking herbal products, and you have received chemotherapy and radiation treatment for cancer. Go and visit your doctor or another healthcare worker if you are worried about your fertility. Step 6. Get to a healthy weight and stay there. If you are obese or overweight, you are at greater risk of a range of serious health conditions such as type 2 diabetes, certain cancers, and heart disease. Men who are obese are also more likely to be infertile. Of course, being underweight is also unhealthy and poses a serious risk to your health. If you want to reach and maintain a healthy weight, you need to make comprehensive long-term changes to how you eat and how much physical activity you do. Regular exercise and healthy food every day will enable you to manage your weight, and being a healthy weight will improve your health now and into the future. Visit your doctor or speak to a healthcare professional if you have any worries about your weight. Step 7. Learn about your family's medical history. Learning about your family's medical history can help you to better care for the health of your child. Perhaps you have a parent with a heart defect or a sister with sickle cell disease. Conditions like these can impact your children, but if you tell your doctor everything you can, they will be better able to check for early warning signs and treat your offspring. After hearing about your family history, or if miscarriages, infant mortality, infertility, or birth defects or genetic conditions are in your reproductive history, your doctor may suggest you seek genetic counseling. Step 8. Deal with domestic violence. Everyone from children to the elderly can suffer the effects of domestic violence. Domestic violence can lead to the death of victims, but more often it leaves adults and children to deal with the emotional and physical damage of abuse for the rest of their lives. If you're experiencing domestic violence, or if you're worried about your temper and your use of violence against your family, you must seek help. Domestic violence ruins lives and tears families apart. Things can change, so please get in touch with healthcare professionals if needed. Step 9. Look after your mind as well as your body. Our mental health refers to how we feel and think and the coping strategies we use. If you want to be in good general health, you need to care about your mind as much as your body. It is normal to experience feelings of stress, sadness, and anxiety unless these feelings continue long term and start to have a negative effect on your day-to-day activities. At this point, you need to seek help and speak with your doctor or another qualified professional about how you are feeling and what can be done about it. Step 10. Care about your partner's health too. You can play an important role in your partner's health as well as your own. If your partner is working on their health to prepare her body for pregnancy, you should be involved and support her efforts to be healthier. Of course, if any of your family members have a health condition, assisting them to remember treatment steps and doctor's appointments can be a big help.